Welcome to the Darcy Wellness Show. My name is Geoff Darcy. I'm an acupuncturist and herbalist at the Darcy Wellness Clinic in Natick. And with me in the studio today is Dr. Artur Gertler, medical doctor, and Leslie Barnett, a licensed nutritionist, would that be?
Certified nutrition consultant.
Certified nutritionist. We all work at the Darcy Wellness Clinic, and we work on a lot of issues together. And one of the issues that we all work on together is cholesterol. And if we could go to kick off right to our first slide, it's pretty astounding to me that 20% of all strokes and over 50% of all heart attacks can be linked to high cholesterol. And that 50% of Americans have levels above the suggested limit. So there's a lot of people out there, Dr. Gertler, at risk. How could you save them?
Well, actually, that's very interesting because studies show that if you just check total cholesterol and LDL, that fraction of cholesterol, you're only identifying 40% of the risk. And you really have to do other tests, usually 5 or 6 other tests to get all the risk under control.
Right. So if we could go to our next slide, what is cholesterol? It's a good place to start from, and then we can start in on how to measure it and that. So basically, cholesterol is a fat-like substance in the blood, made in the liver, and comes from some of the foods we eat. Too much cholesterol can build up in the arteries over time and can cause heart attacks and strokes. And that's a pretty scary clogged artery versus a normal artery there. So what function, what's the good side of cholesterol? What function does cholesterol serve?
Well, cholesterol is found in all cell membranes of every cell in our body, and it's absolutely necessary for life. So too low a cholesterol is no good either. As a matter of fact, people who have very low cholesterols are thought to have an increased risk for cancer.
So what's the healthy function of it?
Well, the HDL, high-density lipoproteins, the HDL portion is supposed to be protective, and it has to do with the complicated metabolic process of transferring fatty substances that are essential inside the cell across the cell membrane.
So it's when that healthy function goes awry, and more often than not these days it's about high cholesterol than low cholesterol. Is that true?
Right.
So when it goes awry, what kind of havoc does it wreak in the body?
Well, the first thing that you see is narrowing of the arteries, which can be tested for. When they close down to less than 70 or 80% of their diameter with plaques, with cholesterol plaques, clots, usually that's where clinical symptoms arise, and you can have heart attacks, chest pain related to angina, stroke, peripheral vascular, not enough blood flow into the extremities and pain there.
So all the bad stuff starts to happen then. If we could go to our slide, our next slide, it's about the recommended level. So how do we measure cholesterol? So somebody walks into the Darcy Wellness Clinic, they want to get a sense of their cholesterol, where it is. What would you do?
Well, the first thing I would tell them is that we'd go through a clinical history, a very quick history, and look for diabetes, hypertension, obesity.
So we're looking, as far as the measurement goes, so we're looking at the total cholesterol being around 200, right. LDL in, different for women than over men, and then we have the HDL. These are kind of ways of measuring the cholesterol levels in the body, right? So you're looking for a patient to have less than 200 in the total cholesterol level when you look at the blood test?
That's right.
Yeah, and what are you looking at for the LDL in women? You want them to be over 40, and tell me about a case walking in with really high cholesterol. How bad can they get? Do you see them in the 300s, in the 400s total cholesterol?
Well, I saw a patient the other week who had a total cholesterol of over 300, an LDL of over 200. Luckily, a fairly good HDL of 55, so that offset. And we have ratios of HDL to LDL or LDL to HDL. The important thing to remember is that the absolute number is important, but it's more important is the quality and the nature of the fractions and how oxidized that LDL is. That's what really causes the difficulty. When it gets oxidized, that's when it gets reactive and starts adhering to
So
clots.
as a rough measurement, the idea is, but you want to look at your blood test and see below 200 as a total cholesterol.
Right.
And then LDL is the lethal cholesterol, is an easy way to remember it sometimes, and the HDL is the healthy.
That's right.
Cholesterol. So you want the healthy level to be around what's a bad HDL, for instance?
Bad HDL would be under 40.
Under 40, so super low, bad news.
Right.
And then as far as the lethal cholesterol, where would you put that at?
And the LDL, anything over 100 is considered abnormal.
Right, so this gives you a picture, but an incomplete picture as well, right? It's not the end-all and be-all of heart disease, but it's certainly a major factor. Now, can you tell us a little bit how we developed this information on what's good, what's bad, just down the road, right, in Framingham, the Framingham study?
Right, well, it was purely a statistical population analysis of people with clinically active heart disease, vascular disease, stroke, and they looked at their cholesterol fractions and compiled statistics on large population studies and came out with normals.
And now there's actually a test you can do on the internet, the Framingham, the ratio of LDL, HDL, and total cholesterol, and it tells you, potential life expectancy. It's always scary. You type in your age, your cholesterol levels, and it will give you a feedback. So those statistics actually give us a pretty good indicator on where we're going with our health, right? The idea that it's a rough idea that we're heading for trouble or we're maintaining a healthy level.
Right. Yeah, and these tests are also checked periodically as people are on therapy. Very easy measures to check.
Yeah. So if we could go to our next slide, what are some of the ways to control blood cholesterol and triglycerides? We should talk a little bit about triglycerides too. So we can control them with healthy eating, we can control them with exercise and activity and just general movement. It doesn't have to be maniac running. It can be just simply gardening or walking around the office, taking the stairs. So physical activity. Weight loss is very important for cholesterol levels, and medication. So let's pick off a little bit now, Leslie, as a nutritionist at the Darcy Wellness Clinic. Somebody comes to you with heart problems, or not even heart problems. Let's say they come to you with high cholesterol levels. As far as the nutritional component, what's something simple that people can attach to quite easily that they can improve on? What's a healthy eating to improve cholesterol?
I think one of the most important things they can do is cut back on red meat and animal protein.
Red meat and animal protein,
Animal protein. That typically is where you're going to find the largest saturated fat amounts in your diet. So that's one step that's very easy.
So cut out completely? Do you recommend cut out completely?
I would recommend cutting out the red meat if it's depending on what your levels are, and go lean towards the leaner proteins, which are the fish, the salmon, whitefish, and chicken, lean chicken. And then you've got your vegetarian and tofu and soy products.
So first thing is get rid of the red meat. The second thing,
definitely.
Dairy products also?
Dairy products, yes. The full-fat dairy products can really contribute to the higher levels, and I would recommend that.
And how do you work with somebody like that? So somebody who is used to eating lots of red meat, or McDonald's, and realize they have high cholesterol. They come in to you as a nutritionist, and they sit down. How does that work? Is that just one visit? Is that a series? Because it takes a lot to retrain eating habits and retrain.
Yeah, it really is. And I think one of the first steps that people need to do when they're trying to revamp their diet is keep a food diary. I call it a food awareness chart.
Yeah.
Because in this chart, we're not really tracking calories or anything like that, but what we're trying to do is get a person aware of what they are consuming. And this can be very enlightening, and they'll see what kinds of meats and actually all types of things that they're eating. Once they become aware of that, the next step then is trying to make adjustments to that diet, and they can then feel in control. And I think that's really important.
It's kind of interesting that 4 of those accepted interventions, the idea of healthy eating, physical activity, weight loss, and medication, 2 of them are food-based. One is, getting your food wrong so that you put weight on progressively over time, and the other is getting the food wrong again, so it's producing too much cholesterol. So over a series of consultations, you work with them to shift away from red meat, to look for substitutes for dairy. Give us some of the other big baddies around cholesterol?
I think a really big bad one that many people don't associate with high blood cholesterol levels is processed foods.
Yeah.
And the reason is that there's many fats in the processed foods, and they are typically polyunsaturated fats, which people feel are very safe.
So give us some example of processed food. What's a common?
Any kind of thing that might even come out of any kind of box. I mean, you're even going
anything
to...
out of a box, out of a can.
Right, and it's typically bread, crackers, cookies, pastries, those yummy things that everyone wants to gravitate towards when they want that quick snack.
They're easy, they're quick,
they're easy,
there's no
quick.
preparation, it's right
there. It
there.
tastes good, and there's that combination of fat and salt, maybe a little bit of sweetness in it that makes people really want to eat those, and those tend to be the worst thing for people with high.
So how do you work with somebody who's reliant on processed foods? Very difficult.
Yeah, it's challenging, but slowly and step by step. Take small steps, and I think that's really important.
So giving them alternative snacks.
Definitely, and giving lots of lists, lots of snack ideas is a really important step.
And then the second factor is not just avoiding the big baddies, it's also about how do you progressively work at weight loss? Because we know that there is this correlation between being overweight and higher cholesterol levels. So how would you approach weight loss, for instance?
It actually comes sort of with when you make these dietary changes. People find that with the dietary changes, you're automatically going to be going towards more whole grain products and higher fiber foods. So that could mean oatmeal in the morning. It could mean much more fruit, incorporating much more fruit in your diet, and vegetables. And then beans also are very high fiber, and all these help to cleanse the blood and bring down cholesterol levels. And you're not limited in how much you can eat, so you can eat as many of these products as foods as you would like. And you'd find that you'd actually shed pounds because they are more calorie dense and nutrient dense as opposed to calorie dense. So that's what you're going for, is the fiber and nutrient density, and that will actually help build your metabolism, and you'll lose weight.
So the idea then, get a bad blood test from Dr. Gertler, start to work with somebody, and just focusing on low-fat, cholesterol-free or low cholesterol foods will automatically transfer over into losing weight. Most of the time.
Yes, most of the time, yes. It'll transfer over to losing weight, but you've always got to separate that losing weight and those blood levels, because those can be two. You can still be very fit and trim and still have the really.
So Dr. Gertler then, so again this clinical picture, somebody's worked with Leslie, they're not really able to get their healthy cholesterol up, the HDL. What would you suggest in that instance? Is that more exercise related? Is that going to be, I guess I'm asking, does nutrition impact LDL and HDL?
Well, most of what we see is that weight loss is a much greater determinant of healthy cholesterol levels than is nutrition. I mean, you can get your cholesterol down. It's very unusual to get the HDL higher. That's pretty much genetic. There's some supplements that can help out, but pretty much it's not going to move that much with anything you do. But weight loss is the main thing. Even 10 or 15 pounds would make a big difference.
Yeah. If we could go to our next slide, again on healthy eating. So basically, high cholesterol, choose more fruits, vegetables, whole grain breads, cereals, pastas, in the most natural form of that as you can, without the white bread, the white pastas, the white rice. Yep. So choose brown rice, more whole grain.
All the whole grains, and the many ancient grains that people are gravitating towards that have a lot of protein, very good fiber.
So define an ancient grain to somebody who's not familiar with that.
One of them that's become very popular, it's very much like a couscous product, is called quinoa.
Yep.
And it's actually a small seed, and it's got complete protein in it, so it's very nutritious.
Yeah.
And tastes really good, and it's very heart healthy for you.
And the idea of baked, choose baked, skinless chicken and fish, why would that be for low cholesterol?
To be quite honest, I don't have a problem. It can get very dry if you cook your chicken that way. And I think it's important to have food very palatable.
Yeah.
Studies show that the skin in chicken is actually a larger percentage of monounsaturated fats. There is still always saturated fat in there. So you won't want to eat the chicken, but if occasionally you bake your chicken with the fat on it.
Yeah.
It's not the end of the world. And some of this
you can
fat
always
is
peel
actually...
it off too,
you
right?
peel
So
it
it's
off.
protected and
Yeah.
kept the chicken
Yeah,
moist.
so cook it with the skin on and then
Yeah.
peel it off. And,
Yeah.
and I make chicken broths all the time with all the skin in, and it's surprising as to actually how much fat is on the chicken broth when you chill it down afterwards. It's very interesting. So take that in moderation. I don't
Yeah.
think it's as horrible as many people think it is. But I wouldn't eat the skin. I wouldn't be afraid to cook
fats
the
from
chicken.
Meat, I grew up in England, and a whole generation that went through the war had no access to butter, so they would use, the fat, the dripping off of the meat, the fat from the meat. They would use that as butter, put it on crackers, put it on bread, and that was it for that generation of heart disease.
Yeah.
I mean, they went down like flies. It was
Yeah.
really and almost an epidemic in England, primarily from the fat from the meat that was used.
That's really, especially when you're eating it
And then
in that
fried
way.
bread, they would put it in. They would do
Oh.
their fry up with the fat of the meat, and then put bread in it.
Oh, yeah.
Just the worst imaginable. So, dairy products. So, low-fat dairy products is also, So, give us an example of low-fat dairy versus cholesterol-high dairy.
Oh, well, you'd want to just go with a skim milk if you'd like that. But I also am recommending to people that they consider trying soy milk, rice milk, and almond milk. They're making a lot of associations with the dairy proteins now, and more to be studied, but cancer rates. So I am, in my practice, recommending that people consider trying the soy milk, rice milk, and almond milk.
So branching out away from
the cow
milk into
cow
more natural milk,
Yeah.
because it is
Try
pretty.
goat's milk,
It is a kind of an odd thing where the only species to drink another species' milk at all, and there is this association through the China study, which is a huge study of millions of people in China that correlated the increase of animal protein, the increase of heart disease, and the increase of cancers. So there is some people would say that the food pyramid in this country is really about marketing. You've got the milk marketing board, you've got the meat marketing board, you've got the cheese marketing board, all getting their lobbyists to get them somewhere into the food pyramid, whereas the data coming out of the Okinawan study, which is a 30-year Harvard-based study, they have they eat a lot of fish. They have 9 to 12 portions of fruits and vegetables. They have 80% less estrogen-receptive cancers. They have 80% less cardiovascular disease than the U.S. So the idea of staying away from the processed food, staying away from the animal protein, there's a lot of data really coming through now to show that.
Yeah.
And it's just trying to get it into people's diets right now.
The other thing that, with respect to the dairy products, it's very hard for people to cut these products out when they've been living with them for all their lives.
Right.
So I do recommend people consider going to goat cheese products as well.
Yeah, and less processed too. I mean, less antibiotics, less.
They're less, and they're finding that the goat protein, the dairy product from the goat's milk, is closer to the size of the human protein, and it's easier to digest.
That's interesting.
So something to think about.
If we could go to our next slide, it kind of covers, just the idea of it not only being about food. It's important as we get older to keep the physical activity up, to increase the HDL. This is one of the ways of increasing HDL is exercise, lowering the lethal cholesterol, the LDL, and also lowering triglycerides. We never really covered so far what are triglycerides and what's a healthy range for triglycerides, Arthur?
Yeah, triglycerides are just fat. It's just another name for fat. It's esterified fat. And of course, it's stored in fat cells in the body, and the level in your blood varies tremendously right after a meal. So it's important to get that fasting. And it's in equilibrium with all the fat cells in your body.
So generally, it's just another measurement of the fat being off in the body. So what's a healthy range for triglyceride?
Well, it would be 70 to 120, 130.
And that 30 minutes a day of exercise really can be a huge help for lowering cholesterol and the triglycerides.
Yeah, triglycerides are not thought to be as serious a risk factor, although they are a risk factor, than some of the more injurious cholesterol.
Yeah. And if we go to our next slide, this is pretty kind of disgusting. It's a photograph of the inside of an artery that has been blocked, and you can almost see that that's a plaquing of that artery that will shut down blood flow and lead to potentially to strokes and to heart disease and heart attack. And and if we could go straight to our following slide, this is kind of interesting. It's an age and degree of atherosclerosis, which is a plaquing of the arteries in the U.S. And we can see age 10 in the bottom left, there's 0 plaquing. And then even at 20 now, there are plaquing at the arteries, which is unheard of even 30, 40 years ago. And then we have 40, the average plaquing at 60, and at 70 in the U.S., it's really quite pronounced, that kind of blocking off. And, going on to our following slide, there was a study of Korean 2,000 autopsies on American soldiers, and they found that they had heart lesions and disease in 77% of the autopsies, whereas the Korean soldiers had none. So in the East, this is far less of a problem, and we know from the Okinawan study that 80% less heart disease, 80% less plaquing from what they're eating as opposed to what we're eating. So as far, and actually while we're on slides, let's really do it to the max. To go to the next one, there's another one that shows the correlation of animal protein. Oh, maybe not that one. There we go. Thank you very much. We see the top at the top right-hand corner in green is the USA, and what this is showing is that it's the animal fat per grams per person per day, and correlated to age-adjusted heart deaths. And we can see most of the industrialized nations like Ireland, Australia, Denmark are at the top. Then comes Germany, Finland, the US. And at the bottom we have more third world, Peru, Bolivia, Mozambique has the lowest amount. So as we eat more animal fat, we have more heart disease. It's pretty clear from the China study, the Okinawan study, and from this study. So, Arthur, somebody walks in, you know all this. How do you begin the process of working with them to actually change some behaviors? So you take the blood test. Any other tests that you might include?
Yeah, we usually look at 5 different risk factors, and many people consider these actually more important than the total cholesterol. Something called homocysteine, another one called C-reactive protein, another one called lipoprotein A, which I might add has 25 times the risk of elevated cholesterol.
Wow. So it's more of a predictor than actual cholesterol.
Yes. And fibrinogen, which is a clotting protein in the blood. And what we found over the years is that cholesterol itself is not the danger. It's just that when it becomes oxidized by chemicals in our environment, in the food, as Leslie was referring to, the additives in food, free radicals that generate this, that's what does the damage. It's the oxidized LDL.
So actually, just to stop you there, because that's pretty amazing. So you're saying that even if you had high cholesterol, if you weren't coming into contact with negative influences from the environment, chemicals and the like, that there wouldn't be that oxidation that would really make the cholesterol disease-causing and make it more lethal.
That's right.
So it's a combination of the two, the high cholesterol and then the exposure to the external toxins. Is that what you were saying?
That's right. That's right. And many experts feel that total cholesterols under 300 shouldn't be treated.
Wow.
Unless there's this oxidative stress. But since
what's the gauge of what in the test would be a gauge of oxidative stress?
Well, you can do tests that are not done in routine laboratories, but they're not specific for cholesterol. So we do 5 tests. As I told you, the clotting tests and the cholesterol fractions and the amino acids, and we... and
the C-reactive protein is more about inflammation,
right,
is it not?
Silent inflammation, periodontal disease, and
that's one of the factors that kind of collides with cholesterol also? Right,
because all of these things eventually react with the common pathway of the lining of blood vessels. They make them sticky, they increase clotting, and they injure them in microscopic ways.
And really thinking about this is, this sounds dry material maybe, talking about it. But, I would say that in heart disease on my father's side and in my, took my mother, took my father, took every one of their brothers and every one of their sisters. And 71, I saw a figure the other day, 71% of heart disease is preventable.
Right.
I mean, that's astounding.
Yeah.
So it can make a real impact. So when you pick it up on their blood test and people actually roll up their sleeves and change their diet with Leslie and work with you, they can actually take themselves away from an enormous amount of suffering.
That's right.
Yeah. So there are other ways of working with this too that you recommend. It's not just diet related and exercise related. Yeah. There are supplements too. And if we could go to our next slide, as a herbalist myself, most people can't probably read that very well at home. I apologize. But there are things like garlic, shiitake mushrooms, maitake mushrooms, reishi mushrooms. There are plant sterols isolated from plants, and gugolipids, which is a sap, an extract from a sap of a certain sort of tree, the commiphora tree, that bind and take out cholesterol and can really have a major impact. That, in my experience working with gugolipids and other herbal approaches, usually the maximum we approach, we can get up to about 20% reduction in cholesterol levels using dietary supplements, as well as trying to encourage people to exercise more and change their diet. Also, shiitake, maitake, and reishi are 3 medicinal mushrooms from the East that have had studies showing that they can lower cholesterol levels. And garlic also has had many studies done on it, and that again has shown to lower blood cholesterol levels. I remember when I was young, I lived with the Maasai warriors in Kenya, and their diet comprises mainly of blood. They're cattle herders, so it's all about eating meat, and then drinking their milk, and even drinking their blood. They have a drink that tastes pretty awful, which is a mix of blood and milk, but their cholesterol lowers are lower than industrialized nations, and it's believed that they use so many local plants from that they cook with and they eat with the high amounts of red meat that they're eating, that they help to normalize, almost as a dietary supplement to normalize their cholesterol levels, and they don't have anywhere near the rate of heart attacks as we do in the U.S. Are there any other supplements, Dr. Gertler, that you tend to recommend? There are the fish oils I know that you use in your practice. Are there?
Oh yeah, some very, very good fish oil, which has got the miraculous quality of preventing sudden death, malignant arrhythmias, and it also has a marked effect on all 3 components of cholesterol.
Actually, I have to just jump in. We've got just 1 minute left, but there was the study in Lyon, I'm sure you're familiar with, where they had, I think it was something like 2,000 people with heart disease and 2,000 people with heart disease taking fish oils, and they had to stop the study after a while because it was unethical to continue, because they found that there was a 70% reduction in heart attacks in the group that were taking, I think it wasn't the fish oil, they were eating more portions of fish. But the group that was eating more portions of fish had 70% less heart attacks and strokes than the other group. It was that significant.
Yeah.
I'm sorry.
Sure. There's niacin is very, very, niacin is one of the few things that will lower lipoprotein A, that very high risk fraction of cholesterol. CoQ10, magnesium. Red yeast rice is a fraction which will act just like the statins.
Yeah. So really there's a lot that people can do for their cholesterol that they may not be aware of. The side effects of Lipitor are quite severe, and coming out, it seems, every other week. So it's not just a sentence to Lipitor. Lipitor can do a good job at the right time, but also I think everyone agrees diet, exercise, supplements, and handling stress have major ways of impacting and lowering cholesterol levels, that we don't have to be sentenced to pharmaceuticals for the rest of our lives, that you can actually roll up your sleeves and get down to work. So Leslie Barnett, a nutritionist at the Darcy Wellness Clinic, thank you very much for joining us today.
Thank you.
Dr. Artur Gertler, medical doctor at the Darcy Wellness Clinic, thank you very much for joining us today. My name is Geoff Darcy. I'm an acupuncturist and herbalist at the Darcy Wellness Clinic. I want to thank you very much for joining us today on our program on cholesterol.